Let me just hand the mic to Fernand and we will go from there.
Morning, everyone. It is definitely my distinct pleasure to introduce Dr. Lane Lasater, who is a retired clinical psychologist who worked for 45 years providing psychotherapy, supervision and consultation in community and mental health centers, corrections, schools, and in practice, empowering individuals, couples, and families to heal themselves and forge satisfying life paths. He specialized in guiding people facing common but challenging problems in living, including overcoming trauma and addiction, creating healthy relationships, coping with family challenges, and raising responsible children. As you can tell, he's an underachiever. He is the author of 3 self-help books, Recovery from Compulsive Behavior, Transcending Family Trauma, and Smart, Happy Love. Lane co-developed classroom curricula for youth and their parents and trained facilitators who reach 50,000 young people and families in 17 states. For this work, he received a National Innovative Practice Award in Psychology in 2008 from the American Psychological Association. Lastly, on a personal note, in the over 30 years that I've known him, he has consistently been accrediting of me and significantly increasing my behavioral potential. Dr. Lasater.
Hey, thanks so much, Fernand. Can everyone hear me? I can't see anyone now, but anyway, let's see. Can you hear me? Okay, great.
Yeah.
Okay, great. Well, hey, Fernand, thank you so much for the introduction, and what a wonderful conference. Holy smoke. It's been running around in my head day and night, and in a good way. My topic today is a descriptive psychology perspective on careers, and at least that's where I started. But as often the case with projects, it took on a life of its own, which I'll tell you about. Oops. So first, I want to start with some quick thank yous. First, as CJ Peak mentioned yesterday, one of the great benefits of the conference and preparing for something like this is the opportunity to read the source material from Pete and so many other descriptive psychology scholars. It's just an amazing experience to recognize the gift that we've been given with descriptive psychology. Secondly, I want to thank Clark J. or CJ Stone in Minnesota in 2 ways. One, he was very helpful to me in getting the project started and giving some really clear feedback. And then secondly, the site, Descriptive Psychology One Bite at a Time, the website, was very helpful to me, and I'm sure to others, because I could read the source material and then I could go to the website and kind of pull the concepts together in a good way. Next and last, I want to thank the 5 descriptive psychology interviewees that I had the privilege of interviewing for this study. And I'll tell you much more about each of them. My topics for today: 1, how I came to this report, my decision to study careers in retrospect, Dr. Pete Osorio as an example of life work, examining life work from a DP perspective, exploring careers of DP practitioners, and the significance of fulfilling one's life work. So I'll kind of go through everything and then hopefully have a little bit of time at the end for questions and comments. During the pandemic, I had opportunity to have Zoom and phone conversations with Dr. Keith Davis, his wife Dorothy Davis, Dr. Jane Littman, Dr. Lori Bergner, and Dr. Reynaldo Garcia. And in the process of each of those, we talked more, as Fernand mentioned a little bit earlier, the chance to know a little bit more about someone's career, even though I'd known something about them. Each individual story is quite fascinating. That inspired me to explore the professional career processes of descriptive psychologists who are now at the late, middle, or end stage of their careers, like many of us are. So first, I surveyed the literature, and I found this wonderful article called "The Convergence of Perspectives on Career Development" from Dr. Charles Chen, a Canadian psychologist. And it's in the references here. Anybody needs the PowerPoints, just let me know and I'll send them to you. But Chen says, career calls for comprehensive and integrated explanations that will reflect a holistic process of human growth, i.e. a portrait of how individuals make sense, construct, and enhance their vocational life in the current world of work. Sounds like descriptive psychology in a good way. Okay. He further says career in this sense has, among other aspects, three core characteristics showing that: one, it attends and goes across one's total lifeline; two, represents a changing process rather than a static state; and three, calls for the person to become the active agent who constantly builds constructive bridges between oneself and one's work-life environment. So as I would read, widely on a particular subject and then contemplate it, I was grateful that I had 10 months to think about the whole process and this presentation, because I'd get somewhere and then I would have another inspiration, coming from beyond about what I should do next. So I recognized after studying some of the literature that I wanted to focus on the concept of life work, which Merriam-Webster defines as the entire or principal work of one's lifetime. Now, as is quite obvious, the study of life work is itself a life's work, and the study of many of the subcategories of life work are themselves life work. So I want you to bear that in mind. This is just a preliminary stab. Further, as I thought about it, I recognized Pete exemplified a completed life work, and I took out several slides because you all are all so familiar with this, but just as a quick reminder, this is a quote from Dr. Anthony Putnam from his foreword to The Behavior of Persons. The behavior of persons is the capstone of an extraordinary construction, the summary of a life's work devoted to a single task. Peter G. Osorio in his life work accomplished a monumental undertaking. He articulated the complex and fundamental conceptual structure known as the person concept. And we all know this is a huge story. For many of us, the privilege of knowing Pete, and I think as CJ Peak was commenting yesterday, to read something and to hear something is one thing, but to watch a person actually enact it is very enhancing in and of itself. So I wrote this, and this is really on behalf of all of us. Having the good fortune to know and work directly with Pete was personally and professionally transformative. He embodied the qualities of an effective healer and teacher: friendly, kind, respectful, funny, encouraging, and empowering. He showed us how to relate to clients, consultees, students, and colleagues. With the foundation of descriptive psychology and Pete's example, we were inspired to go into the world to contribute in our unique ways. The gratitude and appreciation we feel for his many gifts to us in the world is boundless. Now, this picture, I thought you would enjoy. I came across this last year. This was taken in probably in the late fall of 1975. And you'll recognize Many of you will recognize these characters: Walter Torres, Joseph Silva, Marcy McCauley, Dennis Quintana, Lori Aylesworth, and his future wife Dana, and then Pete. This was taken on my parents' ranch in eastern Colorado. Before I came to CU, after transferring from Ohio State, I worked for several months in the ranch. My father was a very gifted horseman, and with his supervision, I trained a buggy team. And so here we were going out for a buggy ride. Ian mentioned in his opening address the other night about remembering the land. Over here in the background, in the very background, you can see these trees, the winter trees. This is the Big Sandy Creek, which ran through the ranch. Tragically, as you all know, the Sand Creek Massacre took place on Big Sandy Creek about 30 or 40 miles downstream. So it's just a reminder of the history of the land that we all walk, and not to take for granted the peoples that were here long before us. In knowing Pete, Mary and others were talking yesterday about bringing psychology to the world, and Pete brought the world into psychology. He brought it from me, and all of us brought it out of the textbooks, out of the classroom, into the world. I was excited the other day, or last night, hearing more about Ned, Charlie, and Nancy's work to build an app about descriptive psychology quotes. And I think that's a huge contribution toward what Ian was talking about and Charles was talking about as well, of making descriptive psychology more available. One quote that Pete made to me at late at night in a Mexican restaurant, or early in the morning in a coffee shop somewhere, and this is during my dissertation, he said, there are 168 hours in each week. You need to know each one by its first name. It's just an example of the incredible wisdom. And I've contemplated that every day since that time, including today. So, all right. So descriptive psychology provides the tools for analysis of life work and its many dimensions. Pete says, a person is defined essentially as a life history. The number of ways that one life history as such can be the same as another or different from it is astronomically large and therefore not directly manageable. Now, I underline that part because I found that to be very true. Like, how in the world am I going to organize all this information? Anyway, so it was a great adventure trying to do that. Descriptive psychology offers the conceptual notational devices to describe and interrelate the myriad states of affairs, processes, and sub-processes needed to illuminate how professional careers actually develop. So, Pete again, career involves a multitude of deliberate actions. A person is an individual whose history is paradigmatically a history of deliberate action and dramaturgical pattern. The most distinctive characteristic and fundamental patterns of occurrence of behaviors in the life history are patterns which involve a variety of different types of behavior, not just a single type. These patterns include social practices. In any given community, social practices are what there is to do. So in DP terms, career involves multiple changes from one state of affairs to another. A person discovers social practices that he or she sees as a genuine expression of self. He or she completes requisite training and experience to participate fully in the set of social practices related to his or her profession. This pursuit of an interest or calling is sequential over many stages. Career choices are driven by external events as well as internal states of affairs. At this point, C.J. Stone commented, made this point, which was very important. In Ian's presentation the other night, he was talking about the null hypothesis, significance testing, and the research replication crisis in psychology. And those external events then pushed Ian and many others in different directions. So that's just an example of that, number 4. The evolution of a career involves multiple appraisals that the behavioral possibilities of one state of affairs are more desirable than another. Okay, so now what do I do? So I came up with 3 questions about life work that I wanted to answer for this small study. How did people discover their life work? What patterns characterize professional endeavors across one's life work? What is the significance of working toward or completing one's life work mission? And my answers are obviously preliminary and represent significant simplifications, both of the topic itself and of descriptive psychology concepts. So the first step, following Pete's guidance, create a tentative paradigm case formulation of life work. And this, I did this to try to organize, okay, what questions do I want to ask people in the interviews? And this is, really a first stab that I came to. Life work involves foundations. The foundations of life work include values of the K, KH, and PC parameters that led to discovering and choosing a particular career path. Guiding lights are the values of the W parameter, including aspirations, motivation, professional vision, and objectives that serve as through lines influencing career decisions and direction. Social practices, I think, has already been covered. Communities, life work is carried on within communities, including governments, universities, hospitals, community mental health centers, businesses, courts, community practice, prisons, etc. And then social institutions, which I think you're familiar with, and I'll say a little bit more about later. Lastly, the concept of realization, the total experience of discovering, conducting, and fulfilling one's career mission across a lifetime of professional endeavors. So this tentative PCF then organized my interview. I developed an interview schedule, and I interviewed 5 of our distinguished descriptive psychologists, starting with Dr. Ian Newby-Clark, psychology professor and department chair at the University of Guelph in Canada, Dr. Lori Berkner, clinical psychologist consultant in Illinois, Dr. David Bender, clinical psychologist consultant in Tennessee, Mr. Clark J. Stone, University of Minnesota Chemical Engineering grants manager and author, editor, and publisher, and Dr. Reginaldo Garcia, clinical psychologist and program director at Alabama and Colorado. So my first question, how did people discover their life work? And I'll just dive down into, the specifics of that rather than trying to do an articulation of this whole question, which is a study in of itself. I found this quote from Dr. Bill Plotkin, descriptive psychologist, in one of his books. He says, it's not possible to save the world by trying to save it. You need to find what is genuinely yours to offer the world before you can make it a better place. Discovering your unique gift to bring to your community is the greatest opportunity and challenge. The offering of that gift, your true self, is the most you can do to love and serve the world, and it is all the world needs. Now, C.J. Stone pointed out to me that this, because he's such a wide reader, he said this embodies many of the principles of Mahayana Buddhism. And I didn't explore that further, but in light of Joe's presentation the other day, might comment on that later on. So pathways to career choice, Dr. Ian Newby Clark. I was fundamentally curious about people and why it is they do what they do. I was interested in majoring in anthropology, sociology, or psychology, and I chose psychology after studying the encyclopedia. This is pre-Google. I started out in artificial intelligence, cognitive science, but was more interested in the human side of things. Excuse me, sorry. Then mathematics, and I was fascinated between the relationship between thinking and behavior. And I can't seem to get this thing to go down. So whatever that last line is, but so on to Dr. Laurie Bergman. During middle and high school, I did a lot of writing, poetry, reading. All I could think of was to become a writer. My mother suggested, based on how well I interacted with people, that I do a report on psychiatry. This led to work several summers as an aide in psychiatric hospitals. Then fourth year, I switched to Albert Einstein community-based unit. I've always been community-oriented as an important place to make a difference. And during college, I was not interested in medical school. Advisors suggested clinical psychology. And although I wasn't really interested, I decided to move forward and found my home in this career. Dr. David Bender. I was interested in calculus and engineering in high school, started college as a math major, then transitioned to biology, chemistry, and psychology. A friend suggested an advanced psychology degree. I was curious about people and different perspectives. I taught Job Corps with inner city youth and Appalachian kids. I started a master's program at Cal San Jose, had a work study placement in Palo Alto. I was quite disappointed in psychology, but Dr. Ray Carlson introduced me to Descriptive, and it was absolutely transformational. And then David says, I arranged to meet Pete in Denver while I was traveling back to the University of Tennessee to finish my graduate work. My life has never been the same since. Clark Stone. I came from a very verbal family and loved writing and editing both fiction and nonfiction. Had a broad background in physics and mathematics and was a voracious reader in physical and social sciences. I ran a publishing house for 10 years and learned to manage and coordinate complex projects. Writing was something I could do and people paid me to do it. Then I branched out to work for private scientific companies, got temporary work, writing and editing at the University of Minnesota. Things went from there. And when he discovered descriptive psychology, he said it represented a sorely needed social mathematics. CJ commented that he started reading the behavior of persons and finally understood it 15 or so years later, a fairly representative experience. Another item, both Ian and CJ are both dedicated readers and writers of science fiction, which I didn't know. Dr. Reynaldo Garcia. I was very blessed with a community where I grew up in Southwest Colorado. My parents, undergraduate and graduate mentors, all encouraged me and recognized my abilities. Meeting Dr. Osorio fully restored my hope and interest in psychology. People confided in me and trusted me. I was naturally given to study and observe people and ask about them. A major personal influence was an uncle who was a very talented artist and one of the most kind and loving people I've ever known. In his honor and memory, I became a clinical psychologist. My second study question, what patterns characterize professional endeavors during one's life work? And in this part, I relied upon descriptive psychology concept, dramaturgical patterns, through lines, intentional acts of description, parameters, social practices, and social institutions. As when presented yesterday, life work is part of a dramaturgical pattern. The dramaturgical pattern is based on the model of a social practice. It's an episode. And that's what human life consists of, this kind of episode. The discussion of self-concepts depended on that you live your life not just engaged in this deliberate action, followed by another one, followed by another one. What you're living is meaningful patterns of deliberate actions, and the closest approximation we have is a social practice. So that's what I mean by a dramaturgical pattern. You have to have that kind of history, not just a history of deliberate action. Now, I was mentioning to Wynn yesterday, I had a chance, among other things, to read a number, of his blog posts. Just amazing, as well as Wynn's books, including his most recent book, which is just incredible. And Wynn introduced this concept of through lines, which I'd never heard the term before. And I looked up more about it. It connects to a through down there at the bottom. A through line is a connecting theme or plot used in media, such as films or books. It's sometimes also called the spine. It was first suggested by Konstantin Stanislavski as a simplified way for actors to think about characterization. So Wynn says, what a person finds significant organizes their selection of behavior. Implementation rests on a recognized opportunity and competence. Implementation is the performance. Through lines serve as a manageable unit for identifying significant and recurring themes in a life history. So, trying to pull all this information together and say, well, how in the world do I characterize the multiplicity of intentional actions during life work for a specific person? And this is the model that I came up with. I first tried to use the paradigm case formulation, but that generated such an overwhelming amount of data, even about these 5 individuals, that I couldn't really work with that. So I boiled it down even further. So over here on the left, intentional action description parameters as through lines. And Tony Putnam had made a comment in one of his articles that personal characteristics are through lines. And I expanded that a little bit to include these 4 parameters. The know parameter, using concept C to engage in behavior B. The know-how parameter, representing the competence aspect of behavior in question, which in turn reflects the learning history of the person whose behavior is in question. And then PC, personal characteristics. Every behavior wrecks some of the characteristics of the person whose behavior it is. And then the W parameter, the motivation aspect of behavior. Behaviors are partly different by a wanted state of affairs. And the W parameter provides a place to specify what that state of affairs is. Successful behavior consists of achieving the wanted state of affairs. So then I took the concepts of community and social institutions as a way of trying to portray the evolution and the diversity of the careers that I was studying here. Social and community, social practices are patterns of behavior, and I think we've already covered that. The second, since an individual is a member of many communities, the totality of social practices of all her communities constitutes her behavioral repertoire. And a person may participate in more than one social practice simultaneously. Social institutions, ultimate and behaviorally complete descriptions can in principle be given by reference to intrinsically intelligible, hence social, public, and tautological patterns of behavior. This aspect of behavior is codified by the significance parameter by the formulations below of intrinsic social practice, social institution, and way of life. So I took this framework and then tried to organize the information from the interviews for each person accordingly. So starting with Dr. Ian Newby-Clark, K parameter, descriptive psychology, cognitive science, social psychology, philosophy of science. KH, University teaching, research, management, and leadership. PC, flexibility in thought and ability to think along with others. Diplomatic, curiosity about people and why they do what they do. W, conduct basic research on the fundamentals of human behavior. Manage, mentor, train, and support professionals. Enhance university governance. Improve campus well-being and safety through effective programming. And then over under communities and social institutions, as I mentioned, I tried to kind of organize these sequentially, from early to later career, but maybe not perfectly. But so for Ian, first community is graduate and undergraduate students and faculty. Within that, sub-community, the flow of consciousness laboratory, where he does a lot of his work on thinking processes. University governing bodies. And one of the things that stood out, obviously, and knowing Ian, you can recognize how well equipped he is for this, but he's very involved in university government, starting with being a department chair and then all these committees and thought groups on campus, which is just so valuable. Professional associations and journals, national and international colleagues, Society for Descriptive Psychology. Social institutions, teaching, mentoring, I can't see the last piece. Basic conceptual research and publishing. Faculty leadership and management. Higher education governance. Multiple campus sexual assault prevention initiatives. And that's working with a number of different universities across, I think across Canada, and professional leadership. So that's for a global look. And then here's I tried to boil it down into one paragraph. Dr. Clark, Newby Clark, creates comfort and safety through offering kind attention, careful listening, deep interest in people and ideas, and respectful communication. These attributes led naturally to becoming a valued leader, mentor, and ally for students and colleagues, conducting basic research on ordinary thinking processes, serving as the psychology department chairperson, developing multiple enhancements in university governance, and multi-university innovations in sexual assault prevention. So, bravo, Ian. Dr. Lori Bergner. K, awareness of community justice and injustice. Fascination with relationships, concepts, and life process. KH, descriptive psychology, clinical psychology, speaking, teaching, and consulting. PC, natural communicator, facilitator, and educator. W, make the world a better place using my particular talents. Empower and educate individuals, couples, and families. Advocate for disempowered people, including women and immigrants. Provide community education about relationships and mental health issues. And in communities and social institutions, there's a strong family resemblance, obviously, since 3 of my interviews are as clinical psychologists. And so you'll see this reflected in Lori, David, and Reggie. Psychiatric hospitals, community mental health centers and community mental health agencies, police department, League of Women Voters and immigrant advocacy organizations, talk radio community, Society for Descriptive Psychology, inpatient psychiatric care, community mental health center, clinical psychologist, private practice with adults, families, and couples, police department consultation, community education and radio psychologist, organizational leadership and facilitation. Now, I didn't realize until I interviewed Lori that she had for a number of years been a radio psychologist. And it obviously, knowing her, we can all see how perfectly equipped she is for that role. Putting Dr. Lori Bergner's life work into a paragraph. Dr. Bergner's warmth and openness naturally inspire communication, ease, and cooperation from others. She pursued her deep interest in and knowledge of people and relationships, become a specialist in working with couples and intimate relationships. Her ability to create community within groups make her a natural leader, consultant, community educator, able to teach and inspire both small and large audiences, including her work as a radio psychologist. So basically, I'd say, Dr. Phil, move over. Dr. David Bender, clinical psychologist and consultant. K, descriptive. KH, descriptive, clinical, deep and respectful listening, patient, teacher, and instructor. PC, like and enjoy people, curiosity about people and their differences, compassion for the downtrodden. W, help people make sense of their lives and work, empower, support, and uplift people through personalized education. Educate and train health and mental health professionals, trust and follow the professional opportunities and processes that unfold. This statement, trust and follow, I think is an excellent summary about how most people's career actually involve. As David said, he didn't necessarily have something specific in mind next, but it would just flow from what he was doing in the context, talents and connections that were made. Communities, community mental health centers, community agencies and state hospitals, addiction and eating disorder treatment facilities, nursing and geriatric facilities, social services, law enforcement and fire agencies, social society for descriptive psychology, social institutions, evaluation and psychotherapy of clients of all ages, staff consultation, supervision and training, agency interface, consultation liaison for fitness for duty evaluations and professional leadership and conceptual development. A quick summary of Dr. David Bender's life work. Dr. Bender approaches others with welcoming humility, kindness, and a unique capacity for deep and careful listening. His compassion, idealism, and passion for empowering people through explaining what actually happens led him to provide psychotherapy and supervision to clients and colleagues in a range of community settings. Additionally, he offered teaching and consultation to law enforcement, health, and elder care facilities, enabling others to spread his healing presence and knowledge. So, well done, David. Clark Stone. K, recognized descriptive psychology as an urgent needed social mathematics. Physics, mathematics. KH, mastery of the extremely complex material, professional writing and editing, desktop publishing, film and TV production. PC, broad reading and interest, well organized. W, help people say what they mean to say. Excuse me, I got COVID in July and my voice has not fully come back, so I still have a COVID voice here. Achieve clear and logical elucidation of intellectual concepts and ideas. Design proposals to meet precise and complex specifications. Master multiple modalities of communication and entertainment. Communities, fiction and nonfiction authors. Scientific and business communities. Private industry and publishing companies. Chemical engineering department and government funding sources, Society for Descriptive Psychology, social institutions, and entrepreneurial writing, editing, producing, and managing, technical writing and editing, university departmental coordination, proposal and grants management, conceptualized catalog and index, complex intellectual material. And a summary for CJ. Clark J. Stone's deep interest in writing, words, language, and ideas began early in life and continues through his life's work, creating, editing, and publishing fiction and nonfiction and scientific publications. A wide reader, his training in physics and mathematics prepared him to help others say what they mean to say. In regard to complex scientific topics, CJ recognized descriptive psychology as the urgently needed social mathematics, allowing precise descriptions of persons and their behavior. His indexed definitions of DP concepts are an enduring contribution to the field. So thank you, CJ. Dr. Reginaldo Garcia. K, descriptive, cross-cultural knowledge and experience, community systems perspective. KH, descriptive and clinical, program development, leadership and evaluation. PC, lifelong learner, natural collaborator. W, educate, empower, and empower individuals, professions, and systems. Promote inter-system alignment and collaboration. Promote community population health. Increase cross-cultural program effectiveness. Advocate for the underserved communities. Medical and residential facility staff and patients. Community mental health centers, agencies, community agencies and schools. Migrant education, health and health clients and providers. Statewide health promotion and planning agencies. Society for Descriptive Psychology. Social institutions, evaluation and psychotherapy with clients of all ages, staff consultation, supervision, and training, primary, secondary, and tertiary health program development and evaluation, system-wide health policy development and research application. Dr. Reginaldo Garcia, Lifework. Dr. Garcia's deep gratitude for the guidance and gifts from family and community and sense of service led him to pursue lifelong professional training and education. In honor of his Southern Colorado rural and cultural roots, he has devoted his career to treatment, healing, and education to meet the needs of the communities that inspired him. His natural collegiality and diplomacy enabled him to develop, implement, and evaluate comprehensive migrant education and health programming in alignment with statewide health and education initiatives, and to leave a lasting legacy. And all I can say is bravo, Rich. Oops. Oh, okay. So another dimension of things that I didn't really get to explore as fully as could be is, how did one, what kind of motivations, both internal and external, led to different transitions. And I used, Reg's career evolution here, and this is what's called a career lattice, which is something I discovered in my reading of the literature. So, as just reviewed, coming from his clinical and descriptive foundations, inpatient addiction, psychiatric treatment, community mental health practice, consultation, liaison with community agencies, justice system and schools, regional promotion, primary, secondary, tertiary health promotion, and statewide health policy and research dissemination. Over here on the right, these are some of the both what I call push-pull transitions. It's things that happen externally, like I was talking about, and that Ian was discussing the other night with changes in the field, but then also the internal thing. So in the early career, there's a lot of experiential sorting. What interests us? What are we good at? Specialization, as in Lori's case. Lori became a couple and relationship specialist because she found one had the firsthand experience of it, and then found that her gifts really led to creating effective couple problem solving. Changes in external circumstances, as alluded to, apply developed skills to new populations, integrate clinical and system knowledge for population intervention. So that's just a quick stab at that part of the story. My third question, what's the significance of working toward or completing one's life work mission? Dr. Osorio, significance. This parameter codifies the meaningful and or ulterior aspects of behavior. In general, behavior has a multi-level structure involving A, the behavior, which is what the person is up to or what the person is really doing. And B, one or more implementation behaviors, which is what observational reports of behavior generally describe. So in my interviews, one of the things I asked people was about their experience while they were conducting and realizing their life work. And these are some of the descriptors that people came up with: challenging, inspiring, humbling, fortunate, grateful, cooperative, and eager, invigorating, fascinating, transformative, innovative, focused, joyful, and rewarded. So in my readings, I came across this term, eudaimonia, which I'd never heard before. And some of you, I'm sure many are familiar with, but I wasn't, which is a Greek term generally connoting a life of meaning and purpose. There's an excellent review of this, which is again by Huda and Waterman in the references. This particular definition I like is from Blaine Fowers. Eudaimonia is defined as a life that is centrally focused on activities that are constitutive, worthy and meaningful in themselves, and consistent with one's values, commitments, and self-identity, with instrumental activities, a means to an end, having a secondary role. So life work is fulfilling one's virtuous potentials. And this quote, again, from the article, the review article on eudaimonia: well-being is not so much an outcome or end state as it is a process of fulfilling one's daimon or true nature, that is, of fulfilling one's virtuous potentials and living as one was inherently intended to live. And I think, back to Dr. Bill Plotkin's quotation about finding one's gift and applying it is a central task for each of us in the world. Okay, well, that's what I came up with, and thank you so much for listening. And I want to just open it up now for comments and sharing.
Anyone in the room have some comments or questions? Actually, there was a consultant on TV years ago who talked about, he would consult people on their careers. And one of the things he said is that people often go in a direction that's actually difficult and challenging. And they think they feel more, that they're more successful if they do something that's difficult and challenging. And he said, that's just the wrong way to do it. And this reminds me of the last part of this presentation. He said, what you should do is go with something that is naturally what's easy and fits for you. But people tend to take that for granted and go, oh, well, that's easy, so anybody can do that. And he said, that is not true. Well, you really should find what you love and is naturally easy for you. And that is the direction you should take. So kind of reminds me of that.
Yeah.
Just want to recommend doing that with Lane, going through that process.
Yeah.
And Lori can talk about this too. It was great to self-reflect in that way, and to kind of take that kind of 30,000-foot view of one's own career in life.
That was the end, everybody.
Yeah.
Thank you. Thank you.
I know when Lane said he wanted to interview me, I said, I don't have anything to say, but it was really fun, actually. Carolyn.
I just want to say quickly on behalf of our late colleague, Tony, His last name is Putman, Putman. So if you're looking up his work, you want to get the spelling correct.
Thanks, Carolyn.
It's one of those names that he spent his whole life trying to get people to get those, in the right order.
In honor of David, my name is Joe Jeffrey. An acknowledgement. I had a thought about where this might be particularly valuable, and also a question. The thought about, sorry for the term application, is looking around the room and including myself in this. When you reach the point where you've got hair the color of ours, or at least of most of us, one of the things a lot of people do is they're looking back on their lives and trying to make sense of it. And it's not, for a lot of people, not always easy. And it struck me that this formulation is a lovely tool for doing that, because it provides a clear set of questions that people could follow. And as someone who has done a very fine job of writing self-help books, well, let me make the obvious suggestion of a way that you could take this that could be very valuable for a lot of people. My question is, as I look at my own, I don't know if I'd be willing to call it a life work, but if I look back at my own life, one thing I had trouble fitting into the framework is there's an awful lot of things that have directions I've gone that have been absolutely accidental. I started off intending to be a doctor, straight, MD. And I discovered I didn't like chemistry, although I liked it in high school. And I never had any interest in studying math. And then I discovered I liked it in college. Then I got into grad school and all of a sudden had this strong visual epiphany in which I all of a sudden discovered, and it was a discovery, not a decision, that I was fascinated with people, which has led me to this in the obvious way. But that accidentalness and discovering something rather than choosing it, I'm not sure how to fit that into this framework. So could you shed some light on that?
I can't, but others may. Thank you. Great question.
Boulder, Torres. There was one instance where I needed to get licensed in Colorado as a psychologist after coming here from Massachusetts. So I had to take this big psychology course to take the test, and discovered, by golly, there's all sorts of psychology that I like, but that I don't delve into it, don't participate in it because I'm working in one particular domain. And what I'm saying is that there are some W parameters that are not inherent to the career, but greatly affect the career. And examples of that W parameter of this sort are making a living. So, so you may choose one path of a career because it allows you to make a living as you want to have, or as you want to succeed with making a living in that particular way. And you choose that path rather than another. Or it could be the W parameter of living in a certain community that leads you then to exercise some options, some career options there rather than elsewhere. So I just wanted to throw that in, that most of the parameters that we saw there were inherent to the career. But there are what I'm saying is that there's some W parameters that are not inherent to the career that greatly affect the career.
Mm-hmm.
Jane.
So I think both of these past two comments kind of highlight one of the things we've talked about in the previous conferences, which is the hazard of using the through line to conceptualize these kinds of forward life rather than looking backward. So the way this term through line originated was that actors or directors were looking through this completed work and trying to make sense of, well, how should the character be behaving? You know, what is the continuity? But you don't have those same aspects that are shown in the personal characteristics. The decisions aren't already made. And so there's a hazard to using through line until something is already complete, and then you can see the connections. So I think the way, I mean, it's just an amazing presentation, Lane. I just, and it just really highlights the specialness of the people. I think those same parameters are the key aspects, and the consistency or lack thereof, you know, the ability to change directions it isn't made clear if you're talking about everything as a through line.
And I also think there are some things that are not career, but are, I don't know what you want to call them, extracurricular activities, but are still connected actually by virtue of values or whatever that could be considered part of life work as well. Okay, we have Errol and then T. And then CJ if we have time. So let's try to move it really fast and give it a couple extra minutes.
Right. I just want to thank you so much. I wanted to just add to the, adulations for the presentation. I thought it was great. I also think that it just reminded me of a couple of just sort of helpful reminders. One is that if we are comparing cases of what something is, in terms of like, selecting cases that seem, kind of at face value as being a good example, if ever there was a case. Sometimes another helpful kind of approach is to also compare those two cases, if ever there was a case where that is not the case, and to be able to kind of use instances where it's clearly not an example of what you're describing. By contrast, that can also sometimes help to define like the boundaries of that, state of affairs that you're trying to describe. The other piece that I'll add is that I think there's also kind of one way of sort of looking at each of these cases that you presented as involving kind of like two phases. One which is more of a proliferation, outreach, communication based kind of a phase, and then the second which kind of accounts in some ways some of the experiences people would think of, like what Joe was just describing about discovering, that can often happen during a proliferation phase where you're just kind of exploring external to what you're familiar with, and then there's a pruning phase where you kind of dial back and you refine and you sort of narrow it down. And I think that recognition of that as being sort of a theme in all of them might also be a helpful way of framing for instances where folks are less successful, but have a clear idea of what they're interested in, then maybe they would benefit from some more proliferation or more exposure to different ideas before, if they're not feeling totally satisfied when they get to like the end of their choice of profession, that kind of a thing. So anyways, I just wanted to add that little bit, and thank you for great presentation.
Thanks a lot, Errol.
Okay, T.
Yeah, well, I agree with everyone. It was really good, Lane. Thank you. I did, and I'm sure you're already thinking about this, but there was a comment in the chat that you couldn't see, and that's just the kind of question. Everyone sounded so wonderful and inspiring that I'm sure in your book, though, you'll have some people do things for like less wonderful motives, more human, more, get down and dirty. I mean, people do things just for a book. Most of us haven't had such, it's just been more complicated, I guess I'd say that, but I know you would do that because I know you, that you're sensitive to the whole spectrum of people find their careers in all kinds of ways. But I know you already know that. So anyway, well, but thank you. It really was inspiring.
Thanks.
Well,
so much.
actually, I do want to throw in one thing, which was some of the accolades were Lane's interpretation of things, not necessarily what I said to him, for instance, about myself. And I didn't even recognize one or two of them. I said, maybe not. I think he thought I was a little better than I was, but that's okay, I guess. Better that than the opposite.
Does that fall in the category of don't put words in my mouth?
No, I think you just think of me better than I think of myself in certain ways, but that's fine. It would be interesting to ask some questions about what are some of the difficulties or the places that didn't go so well or whatever, and what were those reasons. That would be actually interesting.
Or like what Joe said, or someone said, what accidents happened in your life? I got into a psychology because of a blind date. But it would just, just for the sake of your book, but you already know that. So anyway, go on to CJ.
Or ways you changed your what you were doing or found some obstacles in it would be really interesting as well. There's only so much one could do. So, okay, the next person is CJ.
Yeah, Lane knows that.
Yeah, right. CJ.
Well, actually, you guys have all kind of said what I was going to say. So, but Lane, it's just a great idea. I learned a lot about, or was reminded a great deal about people I've known for years. So, I mean, that's very informative. It's very interesting that way. And I also agree with Joe that this is a great self-help book, a great template for making sense of yourself. And one of the things about these things is that it's like Lori said, there's an insider view and an outsider view.
Mm-hmm.
And part of what you bring up was a synthesis. You brought an outside view to an inside story. Now, you could do it for yourself, but in a workbook, there may be a way to get, those are different views, but you can use the same template. I just think it's kind of interesting. It's scary to contemplate. About my age, I started asking myself about what values would I put in for an achievement parameter if there was one in this thing. And again, that would be really different. An outside and inside view of that would be probably quite different. And so that anyway, and then I like what Joe and T said about accidents. I put that in. What are the discontinuities and accidents? For me, that was landing in Boulder for school and then discovering Pete right away. The rest was history. And there's no choice in that. Just boom, and that shaped it.
Right.
Thank you. Good. Thank you so much for everything.
Marvelous. Thank you very much.